The deadliest Ebola outbreak on record continues to get worse. Sierra Leone's health minister confirms that the doctor in charge of battling the current outbreak has himself contracted the deadly disease. Close to 1,000 cases of the virus have now been reported in West Africa, with over 600 deaths. One laboratory in the U.S. state of Colorado has developed a diagnostic test for Ebola and has received a grant from the government. CCTV's Hendrik Sybrandy reports.
Corgenix Medical Corporation in Broomfield, Colorado, prides itself on its response to major medical emergencies.
I think it's because of our size and the ability that we have to be nimble. There's not many layers between me and executive management, and so that allows us to be able to make decisions quickly.
Corgenix specializes in diagnostic test kits like the prototype it shipped to West Africa earlier this year to assist health workers in tracking the deadly Ebola virus.
It gives them the ability to immediately identify potential cases or potential contacts.
We were last here in April. The Ebola outbreak was in its first month or so. It was considered quite serious then, but the predictions were it would quickly subside. That didn't happen. Deaths from the virus continue to soar in Guinea, Liberia, and Sierra Leone. Now the U.S. National Institutes of Health has awarded Corgenix a 3-year, nearly $3 million grant to develop a rapid diagnostic test that could speed the treatment of future Ebola cases.
It gives a doctor or a health worker the opportunity to be able to triage a patient within a 10-minute period of time.
In the field and without using equipment that requires power. Experts say this Ebola strain has been especially deadly, in part because it's not quite as lethal, giving it more time to spread through more populated areas. Some residents' mistrust of medicine has contributed to the problem.
If there are no health services, if there is no connection to the government, then the first time the WHO workers come in, they're essentially starting from scratch. And that's tough work.
Work that could go on for quite a while in West Africa.
It's by no means an insurmountable challenge. It just takes time.
This lab is getting ready to ramp up the fight. Hendrik Sybrandy, CCTV, Broomfield, Colorado.